Welcome to Black Health Matters. I'm Daryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Was the one that talked about the three big risk factors for dementia, which was kind of unusual in the three they identified. They said diabetes, uh, air pollution, and alcohol were the three uh, most important risk factors for dementia in the study that they did. And it's interesting because most people have not targeted air pollution or diabetes or alcohol consumption as the three big risk factors for dementia. They identify a number of factors, but those three factors are kind of unique. And I guess how many people will really pay attention to the amount of nitrogen dioxide in the air? And the diabetes also was a unique aspect of it. Any comments on those three factors as they relate to dementia, which is the commonest mental illness that we have after you reach the age of 50?
What I heard you say alcohol and diabetes. What was the third one?
Air pollution.
Oh.
Air pollution. They said the amount of nitrogen dioxide in the air is a major risk factor.
Mm-hmm.
And they mentioned the other risk factors: hearing, not having hearing aids, not sleeping right, weight reduction, smoking, and high blood pressure. But those are pretty much expected. But the major three that they identified, alcoholism, diabetes, and air pollution, those are kind of surprising to me. Any other comments?
Yeah, I'm surprised they didn't mention loss of hearing.
Oh, they did mention that. I did mention that, but it just wasn't among the top three. Loss of hearing was mentioned in the article. Yeah, but the top three were different from the three that I'd ever heard of before, with alcohol consumption, air pollution, and diabetes as the top three.
Since I don't have diabetes and I've never drank, I'm probably in pretty good shape. I can't do anything about the air.
Yeah, that's the one aspect of it that most people haven't addressed. And the question is, how do you address it? Because you kind of, unless you have filters in the house, which you can have. So, yeah. Well, okay, it's after 9 o'clock. There's no other comments. We can move on to the paper. So this is a article I did for Asbury about ways to reduce your risk for cancer. And since 90% of the cancers are not inherited and are preventable, then we have to look at the ways in which we can modify the risk factors. And one of the best ways to do is to eliminate alcohol consumption completely or decrease it to 1 or 2 drinks per day. And of course, there's a lot of discussion about that in terms of whether or not, if you're an alcoholic, is 1 drink too much? Because will that cause you to binge drink or not? So, but most references will say 1 drink a day is okay for men or women. Stop smoking, nobody will argue that, because 15 to 30 times more likely to die from lung cancer, as well as having many more other metabolic complications as a consequence of smoking. So it's a no-brainer to stop smoking. Know your body, report any changes, any lumps or bumps or changes in the size of or color of moles. That's important. Knowing your body and examining yourself probably at least several times a week. Practicing safe sun exposure, because skin cancer is very common, and it's important to use sunscreens if you're going to be out in the sun, and especially avoid sunning from 10 a.m. to 2 p.m. unless you actually have the skin protected by sunscreens. Staying up to date on vaccinations is important, as we know so much now about human papillomavirus than we knew before, and hepatitis B vaccines, which prevent lung cancer. So that's an important thing to do. And then, of course, the healthy diet with plenty of fruits and vegetables, reducing red meat and processed foods and beverages. High in sugar play a role in that as well. Then, of course, if you have a family history of colon cancer, then colonoscopy before the age of 45 is recommended. And if you have a family history of cancer, sometimes you have to have annual colonoscopies, depending upon the genetic predisposition that you have. And then we mentioned here the role of prophylactic mastectomy. And that is just if you have a genetic predisposition to certain, if they do a genetic test on you and they find that you have certain genetic factors that are associated with increased risk for breast cancer and ovarian cancer, then a prophylactic mastectomy or oophorectomy may well be food for thought. Exercise, 150 minutes, we've talked about that ad nauseum, which reduces specifically the risk of colorectal, endometrial, and postmenopausal breast cancer, and many other chronic conditions. Then, of course, the emotional trauma that we deal with on a daily basis can be reduced by meditation for 100 minutes, 50 minutes per week, and by the taking advantage of psychiatric or psychological experts. Then, of course, one of the things that we don't do as well is keeping our children safe from adverse childhood experiences. And if they encounter them, getting them the mental health expertise that they need so that they can avoid going through life with toxic mental situation because of what they've observed or been exposed to during their childhood. We now know that people who don't have the proper mental health will wind up with more hypertension and more diabetes and more heart disease and cardiovascular illnesses. Then we talked about pollution earlier, but avoiding the pollutants such as you see here, radon, which is in the house, and you won't know unless you get a test for radon, the asbestos, formaldehyde, and other products that if your home is not tested for, you won't know that you have it. And then cancer screening is recommended, including vaginal exams for women after the age of 65 if they have symptoms. And of course, prostate examination for males after the age of 50. An ounce of prevention is worth a pound of cure, and being proactive and putting into practice the above steps is one way of reducing the risk of cancer. These are a long list. Any comments or thoughts about this long list of ways of reducing your risk for cancer?
I had a question, Dr. Callender, about number 5, practicing safe sun exposure. If you're using sunscreen, I'm just wondering if that would block the vitamin D level.
It is not thought to. It will block the ultraviolet rays, though, and that's what causes the cancer. But there's no evidence that it will block the vitamin D because, as you're pointing out, the vitamin D absorption is one of the most important byproducts of getting sun, and we need vitamin D. So,
What is the mechanism that by way that happens? How do we get vitamin D from the sun?
I'm not sure I know good way to answer your question. Uh, I don't know the mechanism. I have to look it up.
Okay.
Any other comments or questions? It's a laundry list, and it's something that we talk about hypertension all the time, and as we age, cardiovascular disease and cancer are the two leading causes of death. So, important for us to have ideas and think of ways to reduce our risk of both diseases. Any other comments or questions? Okay, we'll go to the next one and try to answer your question, John, subsequently about the sun and vitamin D. This is an article that we looked at the last time, but didn't have a chance to discuss. And you talk about the feedback as a consequence of the Supreme Court's decision that DEI, diversity, equity, and inclusion were not mandatory. Then, as you see here, introduced but not voted on yet. But as a bill that if you have DEI programs, that you should be defunded. Medical schools should be defunded, which makes no sense to me. But it's just to make you aware that people are so unhappy about the fact that they were forced to be diversified that they want to punish those people who had the audacity to develop such programs. This wouldn't affect programs like us at Howard because we don't really have a DI program, but many schools developed DEI programs so that they could have diversity in their schools, which was important for many reasons. And so this is an effort to punish those people who actually had developed DEI program. And this is just the beginning of something that is becoming commonplace. People who are angry about the fact that DEI was forced upon them, even though it was in their best interest. They want to punish those schools that actually develop programs. Any comments or thoughts about that?
I had a question. Are there any incentives to having DEI programs?
Yeah, there are many incentives. The incentives are that you increase the minorities in your program. That's the incentive. And the incentive in business is that diversity begets ingenuity. And so the more diverse population you have, the more successful you become. So that's the greatest incentive for DE&I, and that is that you become more profitable and better in what you do.
And also there must be some kind of financial incentives,
Well, that's of course that's the greatest incentive.
Mhm.
It's financial, right? That the more diverse you are, the more money you make. That's why business has become an important aspect of the practice. And the more diversified they are, the better they are, the more money they make.
Dr. Callender, it's bizarre to me that someone would think that a DEI initiative is discrimination.
Yeah, well, I think many of the things that we think are rational and sensitive to some are irrational to others, particularly if you are extremely biased. And somebody says to you that being biased is not good, then and you want to counter that by saying, "Oh, so bias is okay. Bias is nice and wonderful thing to do." And that's to me what the pushback is suggesting.
Helene McGee wrote a book, The Sum of Us, and it points to how racism and white supremacy has cost economically this country so much. And to continue to move in that direction, especially in a global economy, makes no sense.
Well, the good news that it hasn't passed. It's just that the fact that people would even suggest punishing people for DNI, as you say, is going backwards rapidly. Any other comment about that bill in the House? Is there a comment?
Yeah.
Janice, were you making a comment or no? Okay.
Yeah.
Okay, the
Vote,
next
vote,
article.
vote, 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 vote.
Oh, okay. The article you have here, you go to the top again, John. Yeah, this is the opposite position. George Lundberg says, how can you have medicine without diversity, equity, and inclusion? And this article takes the other position, is that you shouldn't have the practice of medicine without diversity among the providers, equity among the providers and the patients, and inclusion of all ethnic groups. I mean, this is just, the fact that we are all Homo sapiens, we're all the same race. So, I mean, the Human Genome Project made it very clear that we're all of the same race, in spite of the social effort to try to pretend that we're different races. We're all one race, and so to try to play games and say that we are not all members of the same race and we're not diversified is going backwards. And that's this article talks about how important it is for us to have that in medicine and to recognize the differences and recognize that these differences are what makes us strong, and it doesn't weaken us, it strengthens us. And that's his position. And this article talks about the fact that you can't practice good medicine without having diversity, equity, and inclusion. Any other additional comments you want to make about this fact?
Dr. Callender, good morning, everybody. This is Sylvia. Do you know the makeup of the medical field in terms of what percentage is African American, what's Indian, what's Asian? Do you know that percentage?
Well, when you talk about the population or
The
or
population in terms of, I mean, when you look at DEI, most time people just think about blacks, and I'm just saying, do you know?
yeah, the Hispanic population is about 20%. The African American population is about 13%. The Asian population is probably about 7%, and the uh, Caucasian population is more likely about 40%.
40%. Oh, okay.
Something like that. Yeah.
Mm-hmm.
Those are general figures. They're pretty close to, yeah.
Mm-hmm. So those lower percentages are the ones that would have been or would be impacted with this DEI exclusion.
Well, actually, what was done was to increase the number of Latinos and African Americans. The Asians have enough representation in schools. Of course, they think they're underrepresented because they think that their IQs are so high that they should be overrepresented. And so they think they should have more positions. Uh, but most of the legislation was to increase the Latino, Hispanic, Native American, and African American populations in schools and in businesses.
Okay, thank you.
Dr. Callender, were those percentages the total population, or
Yeah.
Are there, do you know the percentages of the physicians of those?
Physicians, I think about, less than 10% are people of color, and probably in the same variety as Latino, or maybe less than that. And so the majority are still whites by far, with minority populations well under 15%.
We brought it up a number of times about our preferences for us to have African American physicians, because we know, I mean, it feels like it, but I think we know that we get treated better with an African American physician. So,
Well, that's what the data shows time after time. But the number of people of color who are physicians is very small. Lucy, you know, have any other figures on the physician, since that's your forte?
We've dropped from 6% as it relates to Black physicians, and the number is going down when we look at the number of male Black physicians. So we're going in the wrong direction.
Okay. Okay. Any other comments or questions about this subject, which I think we're going to see more and more pushback from people who have been offended by the DE&I and are strengthened by the Supreme Court's ruling on it. And they want to punish us for having the audacity to have diversity. So we shall see what happens, but I'm predicting that this is something that is going to become more common rather than less common.
Dr. Callender, we're speaking about people going into the medical field, the persons, but I'm just thinking about the donors that donate organs, or people that give blood. The Caucasians are not concerned about whose blood they're getting if they need it, or whose organ they're getting if they need it. So, I mean, they're willing to thrive with our blood, or thrive with our organs, but yet they don't want us to be doctors. Or
well, I wouldn't say they don't want us to be. They ain't looking out for themselves.
yeah, and I
that's
guess
a
what I'm saying
human
too.
trait, is that they
Yeah,
count for me, and it's a natural tendency, but it's something that we need to overcome. But you're right. Your comment is very timely and right on. And I think once we get to the point and recognize that we're all Homo sapiens and we need to all help each other, the better off we will be. If there are no other comments, we'll go on to this next article, with talks about the high dementia rate among disadvantaged neighborhoods. Saying that where you live is associated with higher dementia risk, which kind of goes along with the comment we made at the outset, that that dementia is associated with pollution, as well as, and we often don't consider pollution as a very common problem, but of course it is. The environment you and the air you breathe determines so much about you, in addition to the kind of food that you eat. I thought it was a little surprising to identify that as a factor, because I had really not thought of it. But apparently, these researchers, even though a lot of it uh, involves communities that are not of color, it's interesting that this has been identified as a fact. And then the high risk in men is something else. And the only question is whether this is equally true among people of color. That remains to be seen. And as you talk about dementia prevention, I think the factors we've talked about already, the social determinants of health as well, and the type of food you eat and the exercise all contribute to that. So important because we don't have a real treatment for dementia right now. We don't have a drug or medication or anything else that will stop the progression of dementia. So the best thing we can do right now is to prevent it from occurring.
Dr. Callender, I thought it was unusual, to say the least, that these studies were done in New Zealand. I was thinking it would be here in the United States, but it's obvious that they are across the board factors. Doesn't matter where you are, what country you're in.
Yeah, yeah. Good observation. Okay, let's go to the next one then. It's interesting. Women's heart disease risk can rise sharply after menopause. And what happens after menopause? Why do you think that happens? And of course, it's related to estrogen and its protective effects upon the cardiovascular system. And in its absence, this then makes the women as likely as men to have heart disease. And this then is something that becomes more evident as you study the postmenopausal female and the diseases that they encounter. This also looks
And
at
that goes back to the articles about DIE, because we began to look at these issues when the women became the scientists to address where there was dis-ease in gender.
Very good point. Mhm. Go ahead. I'm sorry. Very good point.
No, that's it.
Yeah, that is it.
The fact that you said it was a good point made my body feel good, because you don't get that out often.
Well, that's so true. You know, when we look at the medical schools now, more than 50% of the medical students are women, and look at the nature of the women in medical school. They're among the brightest and the best, and for many decades, they weren't even appreciated in medicine. So this is all part of the importance of diversity, and for us to go backwards on it is hard for us to do that when it flies in the face of all of the information that we have.
So, Dr. Callender, does that mean everybody should be taking estrogen?
No, it doesn't mean that, because we wouldn't want the men to be feminized. But it shows that estrogen has merit, however, and that it is protective in women, protects them against heart disease. But I don't think anybody would say that. Now, another factor in trauma, Dr. Cornwall has identified an interesting phenomenon, and that is that estrogen was protective against death from trauma. And so although I wouldn't say that I'm going to tell you that all men should take estrogen, it is certainly clear that estrogen is a protective factor. So I wouldn't jump to say that all men should take estrogen, but I would agree it is a protective factor.
So does that mean that postmenopausal women should be taking estrogen?
No, it means that they should be aware of the fact that because they no longer have the estrogen, that they need to be more careful about their health. One of the concerns about taking estrogen is whether or not it will contribute to other aspects of health. And so some of those things we haven't identified. But it is clear for postmenopausal symptoms that estrogen will correct them.
Dr. Callender, I have a question. Is it true that in men and in women, there are imbalances in estrogen and progesterone?
And testosterone as well.
Yeah.
Because as the men age, the testosterone levels drop, and that has its own issues. So that the progesterone, estrogen, and testosterone levels are important in health. And Lucy, any comments on that aspect of it?
I think also, looking at the effects as estrogen goes down, since we both have both estrogen and testosterone, and vice versa for women and men, that having the diversity in the field to ask the questions and seek answers to those changes, and to how it presents itself, like the hairs underneath my chin and things like that. As the estrogen goes down, the levels of testosterone go up, and it has significant impact on how we age and change.
Yeah, that balance is what makes a difference. Yeah. Any other comments or questions? Very good questions you're asking that force us to really try to get the answers, because as we age, the balances change, and as they change, sometimes not so good things happen. And for example, one of the most important scientific recognitions is that as you age, there are factors called senescent factors, which are factors of aging, which affect all of the organs in the body. And it may well be that as we talk about Ponce de Leon and finding the fountain of youth, that these anti-senescent factors may well be related to the testosterone, progesterone, or estrogen balances or imbalances. And so while your suggestion of us just taking estrogen may not be the total answer, somewhere along the line, we may identify that these anti-senescent factors may be related to the balance of the testosterone and progesterone, estrogen imbalances. So over time, it may turn out that we may find that the answer to your question may be something that along the lines of what you suggested. Any other comment? Did that make any sense to you? Because you may not understand what senescent is another term for aging. And so if you have factors that prevent aging, and we have identified some factors which prevent aging, we call them anti-senescent factors, that these factors keep the body from dying, and they keep the telomeres from shortening. And it is thought that the length of the telomeres is what determines whether you live or you die. I'm trying not to be too scientific, but the bottom line is that as we age, those imbalances may determine whether you get the heart disease or cancer or whatever. Maybe too scientific. Sorry.
All of that just lets us know how fascinating medicine is.
How much we don't know. Yes, we know a lot, but there's so much more we don't know.
Mm-hmm.
Now, this is an article about RSV, which is with us, and we finally now have a vaccination for it, which we never had before. And it was a disease which plagued children and adults. And we really didn't have a good way of dealing with it, except dealing with symptoms. And now, fortunately, we have a vaccination that helps children and people over 65. And this is talking about 5 things that we can know about it. And of course, the first fact is that RSV vaccinations are recommended for children and people over 60. And it's a high risk for progressing to severe disease once you get it, particularly in people of the extremes of ages. And this respiratory condition can cause many problems, including congestive heart failure and other infections and chronic kidney disease as well. So far, while we have a prevention, we don't have a antiviral medication that's approved to eliminate it once you get it. So better prevent it than have to treat it. Now we have a lot of symptomatic measures for it: the cough, the headache, the fever. We have ways of giving you bronchodilators and dealing with the mucus that occurs as a consequence of it. But those are symptomatic. But we don't have a specific antiviral medication like we have for many other diseases. And this is interesting. We may not have realized that 60 to 160,000 hospitalizations and close to 10,000 deaths occur as a consequence of this virus. So it's a big problem. Cost of hospitalization exceeding $1.3 billion. So that it's important that we now have a vaccine. So that therefore means it's important to get the vaccine.
Dr. Callender, is that worldwide, those numbers?
That's America.
That's just US? Wow.
Yeah. Just US. Yeah, it is amazing that so many people have been involved with it. And they've been many attempts to have a RSV vaccine before, but they've all failed.
I have one more question. There's a word mentioned earlier, bronchiolitis. I've never heard of that before.
Okay, the lung is associated with the bronchial tube that connects the outer air to the lungs. The lungs is the sac that allows us to have oxygen in the blood. And the tube that conveys the air to the lung is the bronchial tube. And bronchitis or bronchiolitis is inflammation of the bronchial tubes. And if they are inflamed and you can't get oxygen to the lungs, then you can't breathe and you die. So that infection of the bronchial tubes is as important as the infection of the lung. But it's the main tube that leads to the lung, the bronchial tube. So bronchitis and bronchiolitis are inflammation of that bronchial tube.
Thank you.
Okay. All right. Any other questions? I think this is an important addition. Yes.
I was going to say, as we economically and socially, we are having intergenerational living, where because of the pandemic and COVID-19, there pharmaceutical companies, big pharma has looked to making vaccines, but the total health of the family living together becomes a discussion that's very important for our community. So that where one might be reluctant or heard from social media that they shouldn't or don't need to, the fact that they cohabitate with someone at great risk must be considered. And I think it's important for us to share that information and that knowledge.
Yeah, one of the things that is a problem, as you mentioned, is the social disinformation and misinformation. And so information and education is power. And so the importance of us educating the community so they will take the right steps to improve their health care and spend more time in preventing these illnesses. And when we have the opportunity to get vaccinations, to take advantage of them so that we won't need to have treatment becomes important. And so the point you make about the cohabitation is actually influences a lot by the presence or absence of education in the community. So an educated and empowered community is probably one of the best ways to handle that issue. Any other comment? We'll go to the next, unless there are any other comments or questions. There's many, we talk about misinformation, disinformation, and social media as a mechanism. And there's been talk about whether there was an increased stroke risk after the new bivalent vaccine. And this is a study that demonstrates that so far there's been no evidence of an increased stroke risk. We talked about stroke being a blood clotting of the blood vessel leading to the brain, or the bleeding in the brain. And the studies so far are identifying that there's not an increased risk with the vaccination, COVID vaccination. It's important to know as we address issues that are brought us that are real or imagined, but are not valid. So having the community educated and informed about the accurate situation becomes imperative. Any other comments about this article?
Dr. Callender, I was wondering, is there any stats on after taking the vaccination for COVID regarding immobility of certain parts of the body? I know my daughter, when she took it, she said she something was wrong with her arm. She couldn't move it for a while. And I had another person at my church who said the same thing. Is there any information regarding how or people impacted where some part of the body has been impacted with after taking the COVID shot?
Well, you talking about temporarily, you mean?
Yes, uh-huh.
Probably no data on the temporary because there are temporary side effects. Those are the side effects of the medication. And
Mm-hmm.
the temporary side effects are recognized, but they aren't uh, emphasized as much. Because, as you mentioned, there are a number of side effects of the drug, but most of them are temporary. And many of them are managed by taking medication before and after you take
Oh,
the vaccine.
okay. I was just wondering because my daughter's like, I'm not taking that again. I'm like, please, young lady. But she just said how she was impaired. It was temporarily, but it impacted her movement of her arm.
Mm, yeah.
She's not on a ventilator.
No.
No, that's not, that's not, that, you know, a lot of people have had pain, but none of them, not many of them have had paralysis.
Mm-hmm.
Pain has been common, but inability to move it at all
Mm-hmm.
is not common.
Yeah, another person at my church, elder at my church, said this that she had some impairment and immobility. And I
Mhm.
was like, hmm.
Yeah, well, and I think as we use it more, we'll find other side effects. Uh, but I think that the fact that you recognize that is something that is something we'll look forward to as the time goes on to look at all of the different side effects of the temporary as well as the permanent side effects of the vaccine. Now, this is an aspect of vaccination that sometimes goes unheralded. We talk about the people who are transplanted. But we don't talk too much about the people who actually are taking cancer treatments and how this has impacted their ability or inability to be vaccinated. And this article deals with the uh, fact that there's a special way in which these people who are on chemotherapy or immunotherapy for cancer have to uh, be dealt with because some of them cannot take the vaccinations because of the immunotherapy and the chemotherapy. And so this then gives guidelines for those patients who actually have cancer because some of them cannot take the vaccine for 6 to 12 months after they have received their specific immunotherapy or chemotherapy. And even after that, they may or may not be able to reach the levels of vaccinations that are desirable. But I think this is a category of patients for whom special uh, considerations have to be made, just like for the immunosuppressed patients who are transplant patients. Similarly, the cancer patients who have specific immunotherapy and chemotherapy that require special arrangements for their treatment. Do you know of any cancer patients who had to deal with this concern? We don't know of many, but it's a specific population that is particularly impacted by their inability to be vaccinated until the effects of the immunotherapy have worn off and the chemotherapy. So it's just an acknowledgement that there's a special category of patients that we need to be aware of.
Dr. Callender, it's also important to note the type of vaccination it is. I mean, if we're just talking about the mRNA, that doesn't, as far as I know, that doesn't affect cancer patients as much as the vaccinations that have the killed virus.
Well, I think you're making a good point that whether it's a live virus or no virus at all or attenuated virus, it becomes important to know about, because it's, most of the transplant patients can't take live viruses at all, and so they have to deal with would take vaccines that have no virus at all, and so that becomes a factor as well. And I'm glad you pointed out that yes, the mRNA, but also the fact that whether uh, it's a live virus or not a live virus makes a difference, and that most of these patients cannot take any live viruses.
So, is there data about the mRNA viruses and the effect that that has on the
As long if it's a live virus, they cannot take it. Period.
right?
Okay. Whether it's mRNA or DNA, if it's a live virus, answer is no. If it's a no virus and it's just DNA, RNA, then yes.
Okay.
Dr. Callender, I what's screaming is that, to me, that it's so important for us to make sure that people in our family and our circle of influence know how important it is to remain in care, even if it has been some time since your affliction, be it cancer or anything that puts your immune complex system in a compromised state, because accessing care isn't always that easy. And if you don't have a healthcare system or a provider that assures that you remain in care, and a lot of people fell out of care during the pandemic, it's really important to be in care so that you aren't making many of these decisions alone.
Any other comments about this? We'll move to the next one. This is a interesting one where people got together to say that because of the pandemic in California anyway, that they spent much time educating people because of the isolation, and the African American Latino communities felt that they needed to be reimbursed for all of the time that they spent. And so California agreed to spend $2 billion to help that. I don't know if any other states have considered this, but the mental health and other issues that are related to the increased impact of the pandemic is something that was felt by all states. It's just that California has actually agreed to reimburse for it. What are your thoughts, since many of you are teachers and you've had to expend yourself? Any comments or thoughts about this article?
I was just reading that some of the homes did not have up to date or high speed internet connections, and the the um, the learning that was supposed to be going on was supposed to be online. So if you couldn't get online, that was That was a major factor that would, keep them from learning.
Good point. Thank you.
I heard that some jurisdiction in Virginia, nearby here, was also considering a monetary amount from the government because of the learning problem during COVID.
And that very problem, I'm sure, existed here too. It's just that it hasn't been publicized yet. But I think that same internet issue that Buchanan talked about is common all over the country. The presumption is that everybody has internet capability, but I think there's studies that demonstrate that about 10 to 15% of the population doesn't have that internet connection.
I would think that a part due to COVID and the learning situation, and I guess some of our teachers in the group would know, I would think after getting back in school, that would have been a part of the curriculum as opposed to stay after school and do this and this and that. Looked like it could have been incorporated in the curriculum to catch them up to date on major subjects, math and I don't know, just general reading, depending on the age level, instead of, okay, now it's time to go back to school and you start with class 1, 2, 3. I would believe there are a lot of classes, or students rather, at home learning with insufficient materials to learn. And that's how a lot of them got to the point where they just didn't care, and which caused them to fall behind. But if it's incorporated in the regular curriculum, Class A is going to be based on enhancing your knowledge of, as opposed to just going straight into the subject matters. I don't know if I'm saying it correctly or not, but it would seem logical that most of the students, or a good portion of them, percentage of them, might be behind after doing the so-called learning at home.
There's also data that shows that right now the absentee rate is almost 50% in some cities, DC and in the DMV. Some of these students are still not going to school. They're stuck at home, or they want to be stuck at home. I don't know.
Elizabeth, you had a comment?
Yes. Good morning, everyone. Yes, I totally agree. Janice sort of said it all, but I totally agree with everyone, because think of it as an equation. No internet, no books, equal to a lack of knowledge. When we were teaching, we had kids to come into, I don't know whether they're doing it or not, but in talking to parents, I found that, some schools don't even buy books at all. Okay. It's up to the teacher to scour the internet and find resources. And the last thing is, when we were teaching, we had kids that would come in. You may have been teaching 6th grade, but you may have had so many 3rd graders in your class, and so many 4th, and so many 5th. And so you adapted yourself to teach all of them, to bring them up to the level where you wanted them to go, and to accommodate learning styles and methodology to help each child to be successful. It's sort of, that equation has sort of been wiped away.
I heard, I don't know if it's true, that virtual learning has caused test scores to go down.
Well, that's true, but I think the truth of the matter is that the fact that so many of the people who were expected to be virtually learning were not virtually learning. Some of the screens were empty, and I think one of the problems is that if you can't even see the person, how do you know that they are actually virtually learning? And I think that was one of the issues that bothered many of the teachers that I've spoken with, that There wasn't accountability. You know, if you were plugged in but you didn't see your face, you shouldn't get credit for that. And that's one of the issues with the virtual learning that I think has plagued us. Because what you said is quite accurate. It's just that I'm just identifying one of the problems associated with the so-called virtual learning.
Yeah, I'm part of an organization that they train you for getting, the chronic units of education, and their requirement is that they have to see your face the whole time that you're there in order to get those credits.
Right, that's good. That's good.
Yeah, so they do that, but they can see whether you're falling asleep, et cetera.
Yeah, I think that's so important. So important. Any other comments before we go on?
And Dr. Callender, you spoke about the discipline. That was a big major factor because kids were getting on, but you couldn't see their face and you couldn't see them actually doing the work. And teacher had to come up with a lot of creativity. And also there were background, how do I say, background stuff going on. That's where I can see it. That the teacher had to sort of blank out all the screens right quick because of the stuff that was happening in the background from adults. So,
Don't forget about those real long bathroom breaks.
I think all of this education up until we had COVID, teachers barely could fail anybody. The curriculum was the same. They had to write a dissertation. You could have children right there in the classroom that had zoned out. And if they go to sleep, you can't wake them up because you can't touch them. So if you got them in the classroom and they're not focused, and then they had this terminology, if they're not focused, it's a teacher's problem to get them focused. Then a lot of teachers and all of us sitting on there, we know that especially in elementary ed, if you kept them behind or failed them in September, the parent can go over the summer and say it's the teacher's fault that they didn't keep up. So miraculously in September, they will be passed.
Carol, yeah,
and so they continue this process. Everybody can learn. Nobody is kept back. So they had the COVID come in. So everybody was promoted. The kids were behind, but there's nothing you can do behind. Then all of a sudden, oh, the children are behind. Well, they've been behind. And they were behind when they sitting in front of the teacher. They got further behind because they're looking at a screen and there's nobody to keep them focused from going to sleep. Then everybody was passed. Nobody was kept back during COVID. Then all of a sudden, everybody is alarmed that these children are on level. They have never been on level. You push and push and push, but they kept passing laws. Keep them there. Everybody's reading in the same book. If they're in third grade, everybody's reading on a third grade level book, whether or not they can decode or not. The system is, we're defeating ourselves. And now all of a sudden we're upset they're not passing the test. From beginning of time, Dr. Callender, even in your age group, there were children that fell behind, but somehow if they flunked and failed, they were kept back. That terminology is no longer used. So why are we alarmed? These kids they're being pushed forward. Teachers blame the kindergarten teachers. The kindergarten teachers blame the parents and all of this. This is just ludicrous that we're even looking at this, falling behind in math. There's always been kids falling behind in math, but yet we keep pushing them on. They can't add 2 + 2, but yet they should learn about fractions. The whole thing is ludicrous.
I agree. I have a niece who's a teacher and she teaches first grade. And she's had a number of kids where she felt should be retained. And the first step was to meet with the parent. and let them know what the kid was not doing and which level they should be on. And in her case, she said she had to explain to the parent retention and what it meant. And she said, oh no, so and so is going to the second grade. And she said that she could not retain that student. It's against the law. So the student was pushed forward and still didn't know anything, and they just push them through. It's against the law to retain them without the parents' permission. And the parents said, no, you can't retain my child. So she passed her on.
And I know in high school, like my son, okay, Mark is in high school now. If a child is failing and half of your class is failing because they're falling asleep or whatever the problem is, it's the teacher's fault that they're failing. And you got to write all the actions that you took to keep that child from failing. Then they put the teacher on probation for failing half of their class. When half of the class doesn't come, they have the probations, but they say if you miss more than so many days of class, then some action has to be put forth to get the kid to school. And then once they're in school, they're finding out more and more kids are not coming to school, but yet it's the teacher's fault because they're not motivating them enough to come to school.
Sounds like a formula for disaster.
Do they have, what did you used to go to?
Tracks.
No. Do they have a summer school anymore? That, how can you learn in summer school in 1 month what you have to learn in 9 months? And that is stupid. But yet they go to summer school real quick, and the summer school teachers are under the same laws that the regular school teacher is. Okay, you have summer school in July. Then you learn everything that you were supposed to learn from September to June in July, and then you can go next semester and take that course. It's
Dr. Didn't you tell us about they were having some problems in the medical schools with the students falling asleep when they come to the lectures?
I don't know anything about that.
Okay.
No, they
You
don't come
should
to the
ask.
lectures. First place, they don't come to the lectures, so they can't fall asleep because they're not in the class. I'd say about 20 to 30% of the class come to the lectures. So they don't fall asleep in the class, they don't come.
So
what can you do when they don't come?
Nothing.
Oh, let me tell
You
you
have
a
to, you have
story
to,
about
you have
Dr.
to pass
Callender.
you have to pass the exam. And if you don't pass the exam, you don't get promoted. So in medical school, it's whether you come to lectures or not, matters not as much as whether you pass the exam. The exam is national exam, and if you pass it, you get promoted. If you don't pass it, you don't get promoted.
So
But
why have lectures?
I'm sorry?
So why have lectures?
What is your question?
Why do you have lectures if they don't have to come and they can still pass the test?
Well, you see what they do, they videotape the lectures, and so they share the lectures around. So all it means is they may look at the lecture at their leisure. And they just don't have to come to class for it. Now, there's some schools for whom lectures are mandatory, but for many schools, lectures are not mandatory. And you can videotape the lecture and do the lecture at your leisure. What is obligated is that you must pass the national exam. If you don't pass the national exam, you cannot be promoted. You cannot graduate. The systems that you have demonstrate a dysfunctional education system that is reflected in the fact that the United States education system is one of the poorest in the world. And it needs change. Any other comments? Because this is an important situation because our children are at risk. And what is so bad is that you have private school. And in private schools, you contribute or you get kicked out. In public schools, you don't have that, and that's what's to me what's killing our children. But I'm not a educator of that sort. I'm a medical school educator. But anyway, any other comments?
Yeah, if United States has one of the worst education systems in the world, the countries with the best systems are United Kingdom, Canada, Australia, Netherlands, Denmark, Japan, Finland, Germany, and France. So Canada just right across the border. For those of y'all that live northeast, head to Toronto.
Well, you don't have to do that. You go to private school. Now, if
No,
you can't
if you can
afford it,
afford it.
if you can't afford it, that's where the problem lies, because those people who can't afford to go to public schools, they deal with what Carol is talking about, and then that's actually, in my opinion, killing our kids. Because if you can't make it, and you can't compete with AI and what's going on with the computer world, then you've got to go in that different world. That different world is a world of corruption and illegal activity, which leads to shortened lifespan and other things that are negative. And until we address that and deal with that, our kids who can't afford private school are really victims. Any other comment before we move on?
Yes, Dr. Callender, I have a little funny note. I thought it was funny. I experienced in a parent conference with the child and the parent. And in this parent conference, the parent requested the conference. And when she got in the conference, she says, I'm really tired of his name not showing up on the newsletter of no homework assignment. And I said, me too. And then I told the child, please go get your folder and explain to your mom everything that's in your folder. So she said, I don't need to hear this. I said, well, just be patient with us because he's the representative from home when he comes to my class. I said, so just bear with me. So she said, okay. So he began to explain what was in his folder. And then he began to run across the no homework letters. And that was part of the language art assignment, that if you didn't do your homework, I didn't argue or fuss with you. I just said, just write a letter. And I taught them how to write a letter, that they didn't do their homework on this day. And and I had, that's where the newsletter supported me, because I sent out a newsletter and I always look for all the positive things that was in the classroom. So no homework was negative. So I didn't put, if you didn't do homework, your name didn't show up in the homework. The homework captain section. Okay. So all the kids had, congratulations that they did the homework and everything. And when he pulled that letter out that he had written, that he didn't do that particular assignment as well as other assignments, that lady's face just changed. She just changed. And she says, I am so sorry. I said, that's all right. It's a growing thing for him.
Growing thing.
I told her it was a growing thing for him. He had to learn his responsibility and fulfill it, And so that wasn't in an argument. There wasn't anything. It was just like, she looked at the child like all the air came out of her balloon. And she says, Miss Doris, thank you for your time, and I appreciate it. I said, you're quite welcome. And she left. But you can imagine what she said to that child when she got him home. But I learned to accent as much as I could all the positive. And the word spread it, how that newsletter was. But anyway, that was deflating the balloon and making us all walk away with some peace in mind. So thank you.
Thank you for sharing. Okay, let's go to the next article. This is a disease that dengue fever, which is very common now, and in Puerto Rico. This is very unusual. There's been over 3.5 million cases and 1,000 deaths in America. I'm sorry, in Latin America, due to dengue fever. And so this is something that is uncommon in the rest of the world. And this, of course, is something that the CDC is working on. We don't know much about dengue fever here because it's so uncommon. But again, it's associated with mosquito breeding sites. And for the most part, dengue fever is a disease that should really not occur. And they had an epidemic in 2012. And in many ways, it's like malaria in the sense that it's transmitted by mosquitoes.
Dr. Callender, I'm aware of some of the research that was done, and we're talking about like 12 years ago when this first came up in the Caribbean, and the scientists in California were involved. I think it was USC, and they used the latest biotechnology to decode the virus. Okay, and this is where a lot of our research that helped us to develop the COVID virus came from the research that they had done with dengue. And it was at the same time that, if I'm not mistaken, that Ebola was happening in Africa. So they were able to use that the microchips and that technology is actually the same type of technology that they use for the Human Genome Project to figure out the genetic code of the dengue as well as the Ebola. And Obama had all of this in place in advance of COVID. This type of research on dengue would have caused, were it not there, dengue would have spread through the United States, but they were able to lock it down. I think it was like Nicaragua, something like that, where they went and had to go through and find it and do the research to develop the understanding of what it was, the genetic code.
Okay. The consequence. Now, this is an article that talks about something that most people would think might not be a good idea, and that is the role of non-sweeteners in improving overeating. And in other words, sugar substitutes being used to decrease the amount of sugar intake. And interestingly enough, although the numbers are very small, and there's a tremendous limitation on the study, it is clear that the group of patients who had the sweeteners had had a significantly less overeating and weight gain than those people who had the sugar. Not that this is surprising, but it's interesting that they have demonstrated that the role of non-sweeteners, does decrease the amount of sugar that is in the system, which makes sense. But it's something that may be frowned upon by some, but it does demonstrate in the small sample size of over 300 that the importance of substituting non-sweeteners in place of sugar does work, whether we like it or not. There's a role, particularly in people who cannot handle sugar at all. Non-sweeteners do have a significant benefit.
Dr. Callender, I have a question. The insulin that comes from the pancreas into the bloodstream to keep the sugar levels down. My question is, does artificial sweeteners cause insulin to go to work?
No, because they do not have glucose. Glucose is the stimulant for the insulin. And so the answer is the non-sweeteners would not increase the glucose level. Therefore, the amount of insulin would not be increased. Because glucose is the stimulant for insulin.
Right. Thank you.
Let's go to the next one. This is an interesting article that talks about sarcopenia, which means muscle weakening, and obesity increase the risk for death. And by sarcopenia, they meant if you have a you have an increased BMI, but you have a low hand grip strength. And this is thought by some to be one of the newest vital signs. It's not, but in some articles we've had in the past, they suggest that this would be the new vital sign, your hand grip, your ability to shake hands with strength. And so in this article, they're combining the BMI with the low hand grip strength as being an indicator that you are at risk for all-cause mortality. And in point of fact, that's what they identified. So that this is something, so when you shake somebody's hand, of course, as a consequence of the pandemic, we're not supposed to shake hands anymore. But those who shake hands, many have thought that this should be a new vital sign. Not only your temperature, pulse, respiration, blood pressure, but also your ability to have a good hand grip. Anyway, this is a new finding that people are beginning to look at. How about in your church? Do you people still shake hands?
I think not only shaking hands, now we're back to hugging.
Yeah. Yeah, I've noticed that too. Yeah.
Yes.
Yeah. Yeah.
I think hugging is safer than shaking hands, though.
And if they do shake, it's limp. And you're right, Dr. Callender. One time, a firm handshake meant something. Not now. They barely want to touch.
Yeah. Well, as time goes on, it seems like the hugging and handshaking is becoming back again. Like people have forgotten that because of the pandemic, we had decided to stop doing that. But the hand gripping has been replaced a lot by the hand pumping. the fist pumping instead of hand gripping. But so we'll see with time. But it has been suggested that that might be the fifth vital sign. We'll see. Time flies. This
Dr.
is not. Yeah, go ahead. Go
I
ahead.
was going to ask you, does that a weak hand grip, is it any way related to neuropathy?
That's a good point, because if it's related to neuropathy, then that would have a different significance. But the impression is that this is somebody who does not have a neuropathy, because
Okay.
somebody who had a neuropathy would have a weak hand grip. So this is the presumption that you do not have neuropathy, but that you're just weak.
Okay.
And this is something that, we talked about the air pollution, the fact that they found that quaternary ammonium compounds is affecting the brain is something that is frightening. And most of the studies have identified, when we use the substances like bleaching and those kind of things, it appears that these are among the chemicals that can affect the brain. And so we need to be careful about the use of the quaternary ammonium compounds, which we have in our houses commonly as disinfectants, because it can have an impact upon brain destruction. Now, while there haven't been a lot of studies that identified which particular ones they are talking about, because they've identified almost 1,000 of them, it is something that deserves future study, so we can find out to what extent we're damaging ourselves by using some of these products. How many of you use quaternary ammonium as disinfectants? Or maybe you don't know what you use as disinfectants.
You talked about like ammonia?
Yeah, quaternary ammonium. Yeah. They usually have it labeled on it. But it's also identified as one of the possible toxins that interacts with the brain and decreases cognition. So this is a study that merits future attention down the line to see the extent to which the quaternary ammonium products that we use for disinfectants is affecting our brains.
And the most common type of products that we're talking about are glass cleaners, disinfectant aerosol sprays, surface cleaners, tile and wood floor cleaners, carpet cleaners, pet stain removers, and all-purpose and multi-surface cleaning products.
Which are probably common. So we need to take note of them and see, be careful, because it may well be that maybe if you use them, you need to have a mask on or something like that to protect yourself. Hopefully we'll have more studies to help us understand more about this.
Just learn to live with the dirt.
Make sure you leave the house for 3 or 4 hours after you do that.
Yeah, it may be a good idea. This is something that I think Darryl has mentioned before, that hair straightening products entail to kidney failure risk. And this is interesting that studies were done in France. And they talk about the different shampoo and styling lotions and how they affect the kidneys. And I think Dallas mentioned this on several occasions. This is just proving his point again and again. As we look to straighten our hair, keep in mind that sometimes the byproducts are not so healthy. Any comment? on this article?
I remember Dr. Callender in college, not college, but in high school over at McKinley. We had lab techniques, and we had a cat. We did a cat. We had a fetal pig. We had worms. They were all preserved in formaldehyde.
Right, right, right. Everything is in formaldehyde. All our pathological specimens are in formaldehyde.
One of my classmates took the cat home on the bus
Really?
because we had the practicum the next day, and he hadn't studied it. So he took the cat home and practiced. He passed the test though, but he took it home on the bus. Can you believe that?
No.
Yeah.
Okay. This should the next one should be the last one if we have one, because it's 10:30 already. Oh, this is an important one that ovarian cancer is, once you have ovarian cancer, early diagnosis leads to survival. Late diagnosis is nearly impossible to treat. So it becomes important if you have any uh, sign of this that you need to go to your doctor. Cervical screening has nothing to do, the cervix is part of the uterus, the ovary is separate. And so cervical screening has no impact upon ovarian cancer. And so it's important to know the symptoms of ovarian cancer. And so uh, uh, I know my aunt died of ovarian cancer, and many women die of ovarian cancer because they don't make the diagnosis. Sometimes doctors miss the diagnosis. And let's go down to show some of the signs and symptoms. Early satiety, abdominal bloating, abdominal pain, urinary urgency or frequency, changes in bowel habits, extreme fatigue, unexplained weight loss, and sometimes weight gain because of ascites. So when you have any of these symptoms, I think it's important to, especially if you're over 50, to consult the doctor. Now, here's another thing to keep in mind. Sometimes the doctor will miss the diagnosis if they don't do the studies to determine. And so if you have these kind of symptoms and your doctor doesn't do tests that eliminate, you ask them about, what about, is it possible I have ovarian cancer? And there's no single test, but you can do CAT scans and ultrasounds. And they're blood tests, but the CAT scan and the ultrasound of the diagnosis make the diagnosis because they look at the ovaries and look at the size of the ovaries. And so, and it points out weight gain can be a sign because you develop acidic fluid. And so some patients, it manifests itself in weight gain rather than in weight loss. So keep this in mind. And here again, it's important to make an early diagnosis of ovarian cancer, because in 90% of the situations, if it's diagnosed early, we now have treatment for it.
John, can you go back up to the list again?
Early, early satiety means that you can't eat as much as you used to. You used to eat a whole plate full of food. Now you can only eat half a plate of food, or you have no appetite at all. Abdominal bloating, your stomach is big and you don't know why it's big. And sometimes it's because you have fluid in it. Then abdominal pain, or urinary urgency or frequency, or diarrhea or constipation, and then extreme fatigue or unexplained weight loss. Any of those symptoms,
Dr.
if they
Callender.
persist. I'm sorry?
Yes, Dr. Callender. Remember that happened to my sister. She was eventually diagnosed with ovarian cancer. And she was going to a doctor, regular checkups, and the doctor was telling her how fat she was getting. Go to the gym. And then she had her sign up for a swim exercise class. And she said, I just can't do it. I'm so tired. And the bloating, she was wearing maternity tops. And one day she went back again, and instead of her calling her fat, I think you have cancer, just like that. And
Just
so
like that.
to the hospital, Washington Hospital Center, and they diagnosed ovarian cancer. And as you say, Dr. Callender, in this article, it says that it's difficult to diagnose. And of course, with her, it was too far gone. And she did pass, but not from ovarian cancer. She had a stroke, and she may have lasted 8 months, I guess, after diagnosis. But she was misdiagnosed.
The reason why I want to see that list again is because men can have all of those symptoms too, and it would mean something entirely different because, of course, they don't have ovaries. So,
Yes.
Yeah.
Okay. But so women need to take note of that. It's important. Thank you for your attention. It's a great session again. And thank you. Yes, go ahead, Daryl.
Yeah, I'm looking at an article from January 24th from Georgia Institute of Technology that says scientists have combined machine learning and AI from blood tests to detect ovarian cancer with 93% accuracy. And the National Institute of Health says that AI with machine learning have demonstrated greater accuracy in predicting cancer than clinicians.
Right, and I think this confirms our session where we had the presentation on AI about the combination of AI and uh, radiographic examinations as well. So that combination is good, and especially something like AI, or I'm saying especially something like ovarian cancer or pancreatic cancer, which are two of the hardest cancers to treat.
Mm-hmm.
On a side note, I heard this morning on the news that the person who got the pig organ is doing well and is at home.
That's great news. That's great news. Good news.
by the
Okay.
way, Dr. Callender, my daughter still trying to get the pancreas transplant, and her insurance would pay for the evaluation, but would not pay for the operation. So she's got to go back out to Arizona where her insurance will pay for the operation.
Well, that's interesting because the hospital said that the insurance would pay for it. But anyways, it's an interesting difference in interpretation of the coordinators at George Washington, and your daughter's interpretation. So that's anyway, it needs to be reconciled because that's tough. Okay. Any other comments? If not, how was your Easter? And